Hello everyone, my name is Jonathan David, and this is my research project for Biology 316. My topic will be bladder cancer, and I've titled it, Let It Out. The epidemiology of bladder cancer will be expressed here, and I will define more about the types, the stages, the causes, the diagnosis, and the various treatments. Adenocarcinoma is the least common form of bladder cancer, occurring only in 2% of the bladder cancer patients. It is extremely rare in the US. It occurs within the mucus secreting glands within the bladder. Squamous cell carcinoma is not common in the US. It is responsible for 8% of bladder cancer cases. It occurs due to bladder infection, irritation, and urinary tract stones. Parasitic infection by Schistoma hematobium are common in Egypt and in Tanzania. Transitional cell carcinoma, otherwise known as TCC, are most common bladder cancer and accounts for 90% of the cases in the US. It originates in the innermost lining of the bladder. Of the 3 types of bladder cancer, it rarely metastasizes. In stage 1, the cancer cells have started growing in the connective tissue beneath the bladder lining. During stage 2, the cancer cells have penetrated through the muscular wall of the bladder. Stage 3, the cancer cells have moved through the muscle wall and have now migrated into the fat layer. Stage 4, the last stage, the cancer cells have now spread outside the bladder and have moved into the common areas and have metastasized into the local closer organs and tissues, which include and possibly the prostate, the uterus, vagina, lymph nodes, bones, lungs, and liver. Some ethnic risks are stated. Caucasians are twice as likely to develop bladder cancer as to African Americans. It is revealed that 85% of the African Americans with bladder cancer are classified as TCC, the transitional carcinoma cell. Hispanics, Asian Americans, American Indians have a lower incidence of bladder cancer. Genetic and inherited risk have been shown that with increased age, usually around the age of 73 is when bladder cancer occurs. Men are 3 to 4 times more likely than women to acquire bladder cancer. First-degree relatives of bladder cancer patient have approximately double the risk of acquiring the same cancer. An inherited disorder such as Lynch syndrome has also showed an association with acquiring bladder cancer. There are also medicines associated with risk. Chemotherapy medications such as cyclophosphamide and ifosfamide also have a risk of having bladder cancer. There are herbs such as Aristoclochia fenchii, diabetic medication, pioglitazone, and there is also a risk of having arsenic in drinking water, which is not common in the US, but is also within certain medications. The first highest risk factor is the consumption of tobacco products, especially smoking. Smokers are 3 times more likely to acquire bladder cancer than non-smokers. The second highest risk factor is exposure to aromatic amines. These chemicals are shown in benzidine and 2-naphthylamine. Populations that are exposed to high concentrations of benzidine and 2-naphthylamine are workers such as painters, leather workers, metal workers, machinists, rubber workers, textile workers, chronic radiation therapy patients, people in the dye industry, printing companies, and taxi drivers and truck drivers due to engulfing fumes. Some probable risks that are still being researched and may have a connection to bladder cancer are the consumption of coffee, artificial sweeteners, smoked cured meats, and caffeine. Some preventive measures to decrease the risk would be to wear protective gear at work, not to smoke or to stop smoking completely. It is shown that former smokers have a 30 to 60% lower risk of bladder cancer. High fluid consumption is also very important. It is shown to reduce the risk of obtaining bladder cancer by half as compared to individuals that take in low fluid consumption. Some symptoms of bladder cancer are blood in the urine, painful urination, or frequent urination, and in some cases, patients feel all three or see all three. Bladder cancer is diagnosed through microscopic exam of cells in your urine and through cystoscopy, as you can see on the picture to the right. Treatment for bladder cancer are staged depending on what level the cancer has reached. Superficial cancer is treated with immunotherapy or chemotherapy directly into the bladder. During early stages, there's a surgical removal of the tumor, which is then followed up with chemotherapy. During the later stages, which is a little bit more difficult and more involved, there is then a complete removal of the bladder and possible surrounding tissues that might also be affected. This is then followed up with chemotherapy and radiation therapy. Beating bladder cancer, it is shown that the 5-year survival rate, that there is a 95% if it's during early stages without invasion or metastasis. But during the late stages with metastasis to distant sites, it is only a 10% survival rate. Thank you everyone for taking time to watch my presentation.